Thank you for joining us for today's session. I'm your host, Debbie Mathias with the Build Initiative. We'd like to begin with a land acknowledgement from Giovanna Archuleta, Assistant Secretary for the New Mexico Early Childhood Education and Care Department.
I would like to open up this meeting acknowledging our Mother Earth and the land she nurtures us with, the land where our children grow, and the land that provides the food to feed them. When we talk about these resources, we must also acknowledge the lands of our tribal people and the deep spiritual and long-standing relationship of all tribal nations. Today I come from you from Nambe, the land of my ancestors, who cared for it and fought for it so that I may one day live and raise my own children on it. A relationship that predates colonial contact by thousands of years. Our ancestors still speak to us and guide us through our songs, ceremonies, and writings. Through removal, trail of tears, long walks, assimilation, and the idea that by removing children would kill a culture. Our ancestors did not give up. Our tribal people are some of the most resilient people in our country, continuing to raise children to be resilient, who are nurtured through language and culture, the language and culture that cannot be removed. We must also acknowledge all other spirits who were forcefully displaced from their homelands and trafficked for labor and production on sacred native land. All of us collectively continue to experience the adversity that caused our ancestors and spirits who continue to hurt from actions done to them. Take a moment to pray these people find the healing and peace to raise their children in a world that has so many opportunities, but most importantly, create coexistence free of violence. Tribal people are praying people. This is where we are all tied. Our grandmothers and mothers continue to pray over us. And as tribal people pray, they pray for people in the north, in the east, in the south, and the west. They pray for infants, children, adults, and elders, and our non-human relations, each with knowledge to share with us. As this conference begins, I hope that each of you are balanced in all directions and take a moment to appreciate what Mother Earth has given to us and how she continues to nurture us in many ways. I invite and encourage you to learn who are the original stewards of the land you live and work on and support those nations and children of those lands. Thank you.
The Build team is excited to present this 20 webinars in 20 days for QRIS 2020 as we explore ideas, possibilities, and learn together about how we might recreate better, more equitable systems with children, families, and early childhood professionals at the center of our efforts. We're grateful to the many individuals who took time to prepare sessions, generate content, and ideas to share. We believe the sessions will inspire you to build on these ideas, continue conversations, and innovate back in your own communities and states. We've learned a great deal as we prepared for the virtual events. One of our lessons is that a virtual event draws a much broader audience than an in-person conference. The Build QRIS conference was designed for early childhood systems leaders at the national, state, territory, tribal, nation, and community levels. Well, as registration rolled in for the event, we discovered many direct service providers, from teachers to center directors and home-based providers signing up for the sessions. We welcome you to our learning community and look forward to hearing your perspectives. We encourage you strongly to share your comments, ideas, and questions in the chat box. As you know, we had to pivot from our in-person conference to a virtual conference. We would like to say a sincere thank you to our sponsors who made that switch possible. Their support is essential to this event. Well, we've all become familiar with the Zoom platform over the past few months as we've used it to connect with friends, family, community, and colleagues. we want to point out a few features that may be new to you. First, when the PowerPoint isn't showing, you can choose your view. In the upper right-hand corner, click on Speaker View to see the active speaker, or click on Gallery View to see everyone with their cameras on. Next, we encourage you to provide feedback throughout the session by clicking on the participant button along the bottom to open the list, and then clicking on the icons along the bottom of the participant list to respond to questions or give us a thumbs up. Presenters may also use this feature to do some quick polling, so be ready. Make sure to chat with us. We encourage you to be active partners in the session. Please share your experiences and questions right in the chat box. There are some polls in this session. A box will pop up on your screen, and we encourage you to respond. This helps us generate more conversation and enhances our learning together. There will definitely be a poll at the end of the session about evaluation. Now I'd like to turn it over to Carrie McCann to introduce our presenters and launch this session. Take it away, Carrie.
Thanks, Debbie. Today, I'm so excited to be joined by this panel who are going to help us start a conversation about addressing trauma during the time of a pandemic. As we prepared for this conversation, we came up with so much content, we could have kept you here for hours. Instead, at the end of today's conversation, there will be a poll to learn if you would like to dig deeper in any of the areas that we raised. We're thinking about we could do a series or do a community practice depending on how you respond. Tonia from the Jewish Board in New York City will kick us off to make sure we're all on the same page of what we know about the science of trauma. Tonia will be joined by Nikki from Arkansas, Misty from Ohio, and Brandy from Pennsylvania for a panel discussion around our thoughts on mobilizing trauma-informed strategies. We were asked to do this webinar because many state leaders are realizing the significant increase of stress and trauma at every level of the early care and education system across children and families, providers, technical assistants and trainers, and state administrations during this time. And they're learning, they are looking to where they already have supports and relationships and where they need supports and relationships across their state system to address this increasing need. As the panel reflected together, we discussed how trauma has always been a part of our world, and there has always been children, families, providers, and state staff who've experienced traumatic experiences that our own programs and systems need to address and support healing. In addition to the experiences of COVID-19 and the communities that have experienced illness and loss and the economic downturn that it has brought, it is also interacting with a long-standing and ongoing trauma of systemic racism. Our panelists will be sharing their thoughts and experiences from where they sit in the early childhood systems of their state and communities and who they're partnering with to figure out what strategies exist and what is needed for their state and communities. I also share this cross-system frame because of a tenet BUILD has that to address systemic racism and promote equity, and to reach that outcome at the middle that children and families are thriving, it isn't going to just happen in one place of the system. It will be from the combined efforts of our state and community, health, mental health, early care and education, and the human services that support families working together. This frame from Cracking the Code, a documentary you can watch online, shows how systemic racism is perpetuated, not just by bias or implicit bias that many of us may be used to hearing about now, but by the institutions and structures each of us are a part of. The reason I share this during a conversation on trauma is that Tonia is going to help us distinguish between stress and trauma and explore why COVID may not be the same traumatic experience for everyone. We may be used to hearing the phrase now that we're all in the same storm, but we're not all in the same boat. Systemic racism impacts the boat that each of us have access to, and the disproportionate impacts COVID and the economic downturn is having. Another way to consider this work is to look at these 4 levels of change that we can make to advance equity. As you listen to Tonia's overview in the intersectionality of COVID and racism, consider how our institutions and structures have situated families differently because of housing policy, who makes up our essential workforce, who has access to what kind of quality healthcare, etc. Listen for where each of us can take action. It may be in the policies and supports of our family childcare home or center. It may be about the changes that we can advocate for in our community or encourage our state policies to take. It could be that you're a state leader and you can make different decisions about how funding and policies work as you look to recover from the impacts that COVID has brought. So I'm eager to get this conversation started. So we're going to move next to our poll. And we wanted to take a quick minute because there are a lot of you and to confirm to who has joined us today. So please tell us a little bit about yourself and in the categories of the poll. If you don't see yourself represented, please share with us in the chat. It looks like we have a good proportion from the kind of technical assistance support to early care and education programs. About half of our audience is that today. And then we have some representation across all the others, from those who are providing direct services to QRIS directors, state leaders, philanthropy, and advocates. So thank you so much for joining us today. And if you haven't had a chance, if you fall in a different category, please share that with us in the chat. And at this point, I'd like to turn it over to Tonia to help us with the science of trauma.
Hello, my name is Tonia Spence. I'm the Senior Director of Early Childhood Services at an agency called the Jewish Board. It's one of the largest social service agencies in New York City. And so I'm here today to think about and talk with you about trauma-informed care. But I can't do trauma-informed care without including and connecting diversity, equity, and inclusion. Sometimes in our work, we often silo varying parts of the work. We think of social emotional learning, trauma-informed care, diversity, equity, inclusion as separate, when really they all tie together in supporting and developing children and families in our communities. There's no way that we can talk about trauma-informed care without thinking about diversity, equity, and inclusion, because as we do trauma-informed care and we roll out those initiatives, we need to be thinking about ways that our communities may have experienced trauma, what might be some of the different traumas that each community has experienced. And so in being able to create a safe environment for all, we have to consider both where are people from? Are they people of color? Are they indigenous people? Where are the different communities that we serve? What might be some of their traumas that they've already experienced before getting to the trauma of COVID in this moment and the huge anti-racist movement, in addition to the financial crisis that many of our families are now in. And so if we don't hold those two things, we often don't really support trauma-informed care. So I'm gonna start by talking about the ACEs. And so the ACEs was done, it's called the Adverse Childhood Experience Study. It was done in 1997 by Kaiser Permanente. And what happened is there were two doctors, Dr. Ander and Dr. Finetti, who were really thinking about and looking at, they kept getting patients that were coming into their offices, and they were thinking about what are some of the reasons that I can't help this young woman stop smoking, or I can't help someone lose some weight and it's leading them into diabetes or other issues. And they started to ask themselves questions about what might be getting in the way that I can't help reduce their health outcomes and change their health outcomes. And so they started to ask some questions. They did research with 17,000 people in Southern California. And what they found was when they started to ask 10 questions about abuse, neglect, and household dysfunction, was that they found a dose-response relationship to negative health outcomes. So what they found was if someone had experienced abuse, whether physical, emotional, or sexual abuse, that had an effect on their health outcome as an adult. So they started asking people from 0 to age 17, have you ever experienced neglect, either physical or emotional? They started to ask questions about household dysfunction. Was anyone in your home mentally ill? Did divorce occur? Substance abuse, incarceration of a parent or someone very close to you? And those outcomes started to help them understand that, if someone has had several ACEs, several adverse childhood experiences, they may actually have more negative health outcomes or more challenges with their health outcomes. The dose response doesn't mean they will have that, but it does say they may have these adverse experiences and health outcomes. So when they look, the thing that's important to remember about the adverse childhood experience study is when they looked at families, they looked at 75% of the participants in that 17,000 were white. 26% of them have one ACE and 12.5% have 4 or more. So we know now in many studies that often people of color and marginalized communities often have double or triple those. And so when this study was done, they realized how many people were being affected. And yet that was in a community where they don't often see as much risk. And so what they found was the more ACEs that you had, the more risk you had for smoking, alcoholism, maybe drug use. So it doesn't mean you will, but you could. And so they started to look at this dose response, right? So if you've had 3 doses of different adverse childhood experiences, what might be your responses? And of course, the higher your ACEs, the more risks you were at. And so they started to realize that life expectancy even could be reduced by 20 years if they had more adverse childhood experiences. And so they really were thinking about, how do we help young children? How do we help adults? How do we begin to think about childhood experiences? And so many of us are looking at young children. And so we want to think about trauma for young children. So let's look at the next slide. So everyone has stress in their lives. Children, adults, we all have stress. And so here I'm trying to demonstrate the different types of stress that exist for families and children. There's normative stress that we all have, right? Preparing for this today, showing up, I have a little bit of stress to get me going. So normative stress sort of helps us, gets us acclimated, gets us going to do things. For adolescents, if you have adolescents, sometimes parents are like, why aren't you moving? You have an SAT, you have an ACT coming. Why aren't you studying? Why aren't you doing these things? Because you expect them to have a little bit of anxiety about it. That's appropriate and normative stress. And then what we have is a lot of families and young children who live in toxic stress, have a lot of emotionally, what we consider emotionally costly stress, live in communities where there's community violence often, are in neighborhoods where they're hearing or experiencing things that are scary. Walking home from school may not be the easiest thing for every child. Some families live at the threat of eviction constantly. Many children have had the recidivism of homelessness. And so those are costly stressors. They're constantly at the door. I was listening to an NPR recently, and there was a mom on there sharing that her and her children have a home now. And a year ago, they were homeless, and she's recently lost her job. And she can see how each child at different ages is beginning to react to her losing her job. Some of them are crying more. One of them is constantly pulling on her and saying, are we gonna lose our house? Are we gonna lose our house? And so she recognized that this is an emotionally costly time for her family, right? And it can become overbearing and overwhelming for young children. And when they don't often have words for it, sometimes you see it in behaviors. Maybe they cry more often. Maybe they hit when something occurs. And so depending on the child, you have to think about what's happening in the environment, what's going on for families. We all know that right now, many families are struggling in food deserts. And so that's an emotionally costly stress when you're constantly looking in the refrigerator, thinking about, I need to feed my children at least usually three meals and some snacks a day. It's really costly on many families and households. And then we have traumatic stress. Usually we put those in categories of war, hurricanes. COVID is probably a very traumatic stress for many. 9/11 for New York City. If you live in certain states, maybe earthquakes might be something that's traumatic for different families and different people. And so thinking about those bigger stressors that come and invade, and for different people, when you've lived in toxic stress for a while or emotionally costly stress, it can be really hard when a traumatic stress comes on because you're already at a level of anxiety, and then it sort of spirals out of control or grows bigger because of the toxic stress. So when we think about responses to traumatic stress, we have fight, flight, or freeze. I'm sure many of you have heard of this. When we think about fight in young children, that can look very different ways. Again, it can look like hitting. It can look like growling. You know, after 9/11, I worked with a child at 4 who, after being exposed, actually was down by the World Trade Center, saw body parts falling, and was in an ambulance. The way he experienced the world was anyone knew he growled at, and he screamed, and he would take his fingers and act as though he would scratch you if you came too close. He was in fight mode constantly, no matter where he was. Even if he felt safe, even if he was in a safe environment, it took time for him to feel like he was safe. Flight, for some children that can mean running. For other children, it can mean not being present. It can mean daydreaming all day. They just can't stay in their body. And then there's freeze. One of my colleagues talks a lot about watching a young child. The reason sometimes people use turtles too is because we sometimes teach young children to go into a turtle when they feel unsafe, like, right, close up, breathe, and then come out and see if you feel a little better. You get to tighten your body and open. But also freeze can really be a moment where a child just can't respond, is standing and looking. Adults have a similar response when they're scared. And it can come up and look various ways. And so we want to think about how this looks in a school setting and for families at this time. And you want to think about how it might look for staff at this moment. Often I put the bear up because people who have experienced trauma often feel like they're waiting for the bear to come out from around the corner. They are often on pins and needles about what's coming next. Most of us don't have that feeling, but many of us who've experienced trauma and have had different triggers and are always worried about what's coming are often feeling like there is something coming. In Circle of Security, if any of you are aware of that in that model, they talk about it as shark music, right? Where there's like, it's always playing. You can be at a beach and it's playing because your trauma might have been around water. We can't determine when a child or a family will experience these triggers, but we have to be conscious and aware that they come and that they can be scary. And one of the things we want to help is to help children not feel like they have to be in that constant state of fight, flight, or freeze. So the way to keep in mind how our brain works is at the very base of our brainstem is, am I safe? If we think about Maslow's hierarchy of need, at the bottom, it talks about physiological safety, right? Food, water, shelter. Do I have those things? That's one area of feeling safe. And for some of our families, they actually don't have that, right? They don't have a home. And then safety comes next in Maslow's hierarchy of need, right? The ability to feel secure, the ability to feel safe. And so one of the things we're constantly working on in educational settings is, how do we create a community that feels safe for children? So that then they can go to Maslow's next step is, right, psychological safety. And then he talks about belonging, esteem, and self-actualization. And in our brain, the emotional state of, am I feeling loved and cared for? And then we get to the executive state, the prefrontal lobe of now it's time to learn. So many of our children sitting in schools and classrooms are in the am I safe zone for much of their day. And then they're maybe in the emotional zone. And so getting to the learning zone takes some work. And one of the things that I like to give as an example of equity versus equality in arriving at safe brain is a child walks into school late. They come in, the breakfast cart is still in the room, but breakfast is technically over and somebody may be coming to get the breakfast cart soon. And the child says, can I get some food? Often teachers will say, oh, you're a little late, especially if the cart is gone. No breakfast today, sorry, you missed it. That's equality. When we say to children, 7:30 is when breakfast is, if you didn't arrive, you don't get any. That's equality. That's saying everybody starts at the same point. Equity says, this child is asking for some food. Maybe he didn't get to eat this morning. And maybe he's late because his mom has 3 other children and had to get them to school. Maybe the bus didn't get to her on time for the child that she has in a special ed program or in another program. So thinking about equity versus equality is a constant state that we need to be in as educators and as school leaders, because we often live in a state of equality. And really what we want to be thinking about is, this child may have not eaten. If he's asking for food, maybe we need to go find him a snack or something he can eat. Maybe we need to keep snacks in our classrooms, and when children are hungry, we allow them to eat. Those are the things we need to do, because that allows the basic needs to be met, and it begins to develop where I'm safe and when I'm not safe, who will keep me safe and who won't keep me safe. As you can see here, it just spells out a little further about fight, flight, and freeze, and how we sit in our survival brain sometimes when we have something that triggers us, especially if we've had a trauma that really has been consistent and we're worried. Sometimes we can sit in classrooms and watch children get triggered by different things and won't always know how to respond, but pausing is a way for us as individuals and teachers and leaders to think before we go in when a child is upset or in a fight, flight, or freeze state. So here, what you see is the nervous system, right? We talked about the brain and what happens. One of the things I left out is often when there's constant anxiety and stress, something called cortisol fills our body. And our brain over time gets bathed in that. It's not the greatest thing to constantly be in, and not the greatest state for our bodies to be in. And so what we see here is the activation of the amygdala happens constantly. There's difficulties with learning and memory. And remember, it's partly because of the difficulty of arriving at, right, the frontal lobe, where we really need to be thinking in our reward center. And so just slowing down, years ago, we didn't really know how much trauma affected young children and their brain. 40 years ago, when infant mental health really became something that people were talking about, people always said, well, how do you know it's affecting children? We didn't actually have the science behind it back then. Now we have real science that demonstrates what people who were doing infant mental health work really understood from what they were seeing anecdotally. Now we have the science to sort of talk about and think about. So how does trauma impact our immune system in our bodies? When we have heightened levels of trauma, we have more inflammatory glands going off. We have more inflammation in our body. We talked back in the ACEs, right? When you have different adverse childhood experiences that are affecting you, they can then affect how our body communicates, what happens to it. And so here it is, we see there's cardiovascular disease, right? That was also an increased risk. One of the other things we've been learning is that it can affect our DNA, which is really big. We have something called telomeres. I'm not sure if I pronounced that correctly, but nonetheless, we have something called telomeres in our body that get shortened when we have heightened and consistent trauma, and our bodies are responding to it constantly, and we're often anxious and it's revving up in us, and we're seeing the bear or feeling the shark music or hearing the shark music. Those things keep us replicating our DNA in a different type of way, which again puts us at more risk for diabetes and cancer. These are important. This is important information because it's given us the knowledge to think more specifically about how to support young children and how to push for better resources to tackle trauma in young children. So now if we move to the next slide, we'll see the 3 E's of trauma from SAMHSA: event, experiences, and effects. The event of trauma, what the 3 E's speaks to is the fact that the event, what happened, is based upon the experiences. What did I bring before the trauma ever occurred? And what effect might those experiences then have on who I am? So we can have 2 children in the same house who end up having different effects from the trauma. An example in one of my clinics is 2 children, both in a home, both heard domestic violence, both experienced and were witness to their parents fighting and then one of them being hurt. One of the children in her play, as we did trauma work in CPP, was around being in an ambulance without an adult. Her fears and her anxiety have become increased. She had a lot of anxiety about being separated from the adults and the caregivers in her life, whereas her sister's anxiety was really about watching her mother get arrested. What police do to you. And so in school, her teachers would describe daydreaming. And when we went to visit, what we noticed is her classroom in the class she happened to be in was right across the street. The windows faced a fire department. And so every time the fire engines went off, I could see her jump, right? No one had really thought about it. To her teacher, it just looked like she constantly is daydreaming and not paying attention. But what's really happening for her is she was constantly being triggered by these sirens that were happening around her. So as we think about trauma and COVID, and we think about the 3 E's, events, experiences, and the effects of them, we want to think about them from a diversity, equity, and informed place, right? Some of us have had the privilege during this pandemic to be home, to work from home, to be able to be in a safe environment where no one bothers us. We have adequate health care. We've been able to even do some of our health appointments on camera through telehealth. Then there are, and we would call that a privilege, right? That is a privilege. I've had to say that to my friends many of times. The fact that I don't have to get on the trains every day has been a privilege for me. And then there are others who have been marginalized. It's a larger percentage of our workforce. They work in our grocery stores and they're in our hospitals, some of them. Some of them have limited childcare. They're more likely to be immunocompromised because we know in lower income communities, there are higher levels of ACEs, higher levels of trauma. And so they may be more immunocompromised, and they may even be living in communities that have food insecurities. And so when we think about that, this crisis is not affecting all of us in the same way. And we've talked about it as though it has. And so that means that for some of us as administrators, we've forgotten to ask some questions for our staff to ensure they even have the ability to do some of what we've been asking them. And then if we think about, this person uses the term destitute, families who may not have the ability to social distance, who live in homeless shelters, or who may live in several family homes. So there may be 2 or 3 families living in an apartment in New York. That's very common. And what made it easier was people would go in and out for work and be in at different times. But right now we're asking everyone to stay home. So no financial support. So if they lost their job tomorrow, no ability to be able to pay their bills or buy food. Low or limited access to water and disinfectants. You know, not everybody could go out and buy $20 worth of toilet paper when the pandemic started. Many families were really struggling to get things because in their communities, those things were gone, but yet there were no extra supplies for them. And then some may not even have shelter. And so thinking about that and thinking about that this crisis has affected each of us differently. If we think about the intersectionality of all of this, right? So when we went into the pandemic in my own programs, one of the things I immediately did was start to think about the different layers of staff that I have. I had to think about who may need a desk, who may need a chair, who may need a computer, who may need access to Wi-Fi. How will I help them with those things? I can't assume everybody has it. How do I send out emails to get a quick understanding of what's needed or what may be something that people need? And so I started to think about that. I started to thinking about how are my porters going to manage? So each of the different levels of staff that I had to think about each of them and what they may need. And it was hard. As much as I do this work and I think about the intersectionality a lot, one of the things I left out was, you know, I had a lot more young people that are living at home today with their families. And so, you know, I have younger staff who are now clinicians and have gone to college and are doing this work, but they're home with maybe older adults in their home who they're very worried about, and they couldn't come out to even get a computer if they needed it. And so we had to think about how do we get the supplies and the things that people need to them. Whereas some people could come to the site still when I was there while others couldn't. This intersectionality piece is different for each person. And I think one of the things that makes us want to live in equality as agencies and in programs is it's easier to think just one strict rule for everyone versus equity, where we have to think about some people may be starting at different places, which means I may need to provide more for them than others. We did the same when we sent things home to schools. I mean, children, we had to think about what were all the things some children will need in their homes. And so we quickly thought about and asked families what they thought they might need. And then we sent based on what the needs were. We couldn't just send based on, we think everybody needs this, especially in not-for-profit where we don't have the funds always to do that for everyone. So one of the things I want you to just keep in mind is each of us is very different. Everybody comes with their own intersectionalities and places that they start. What are some of the things that might occur if you have families that are in marginalized communities and may feel more stressed than others? What are some of the ways you're providing support? Those are the things to be keeping in mind as we move forward. And just something to remember is that each of us rides the wave of trauma differently. Sometimes when trauma happens, because of our privileges, because of the things we've been given, we're able to stay on the board and ride it out and think through things. And other times we really get knocked over by what happens in our communities and what's said to us. And so just keeping all that in mind.
Thank you so much, Tonia. I really appreciate that overview. We have a minute to pause. If there are some burning questions, please share them in the chat. We're happy to take a minute to answer a couple of questions if there's any clarifications or things you want to ask Tonia about. We also have our panel conversation coming up, and so we can also embed some of your questions into all the panelists, if that makes sense. So we'll just give you a minute to see if any questions pop up in the chat. So Tonia, if some questions pop in the chat, we can definitely address them. What I think I'll do is move to the next slide and we'll do the panel introduction. And actually this is building off of the science presentation. So what I've done is asked each panelist to introduce herself by sharing who they are and where they kind of sit in the early childhood system, so you have a sense of who is on the panel. And then I wanted them to each share with you one aspect of the science presentation that either really resonated with them or something that they'd like to emphasize. So Nikki, I'm going to start with you, and if you could introduce yourself, that would be great.
Great, thank you. I'm Nicola Edge. I work in the family medicine department at the med school here in Little Rock, Arkansas. And in my role there, I manage and I study programs that are designed to help early care and education professionals support the social and emotional development of children and become, in particular, better equipped to support children and families that are impacted by trauma. And I just really appreciated Tonia's presentation, and especially this emphasis on holding in our minds the idea that we have been in the same storm but not in the same boat, and even for many of our children and families and the staff and the programs we work in, they were in other storms before this one, and so the ability to ride the wave may be a lot harder. And so when I think about models of trauma-informed care and how those of us who work providing TA or coaching or supports to programs to help them achieve some of those models, I really think about the components around trauma awareness and trauma identification. How would we help programs know how to understand and identify how their staff, how the children and the families that they serve have been impacted by this storm, by prior storms? And what kind of boat have they been in during this time? And that's always true, but it feels so important now in this context. I think about, a program here in Arkansas that serves so many families that work in a food processing plant that was super hard hit by COVID. Very different than another program that might just be a couple miles down the road, but experienced this crisis so differently. And so I think just really remembering that we have to help our early care and education community have the skills to know how to ask and listen and watch for how members of their community, families, and individuals have been impacted in this crisis and by any storm that they may have experienced or that is to come. I think we have a real role in equipping our field to know how to ask.
Great, thank you, Nikki. Misty, would you like to introduce yourself to everybody?
Absolutely, thank you, Carrie. I'm Misty Cole, and I am with Hopewell Health Centers in Athens, Ohio. And today I am actually sitting in for Dr. Valerie Alloway, who was pulled to the governor's office to help with some race and equity talks in Ohio. So this was an honor that I wasn't expecting, but I'm thrilled to be here. My job is to do early childhood mental health training in the state of Ohio. I'm one of 6 master trainers here in the state. We do a lot of conversation about trauma and a lot of conversation about race and equity. So I too really enjoyed Tonia's presentation. And I think the part that stood out to me the most was at the very beginning, where we looked at that intersectionality of trauma and culture. And someone said it in the chat box, which I appreciated. That's a point that isn't often made. We look at trauma from a standpoint of abuse and neglect and household dysfunction. But oftentimes we forget that abuse and neglect and household dysfunction look different when you're not in the same boat, right? Just to kind of piggyback on what Nikki said as well. And so I think that's the part that stands out to me the most, is that lens, when we're looking at it, isn't the same lens for everyone. So we know that fight, flight, and freeze response that people often have, that's going to look different based on what boat you've been riding in. That's going to look different based on what your trauma has looked like. And so I think that's just so vital to know as people who are working in the field, no matter what your role is that piece alone, when we're able to focus on it, starts to bring in conversations that aren't always comfortable. And so in my experience with working with trauma in Ohio, and particularly COVID and also race and equity, I hear people avoid these conversations because they're uncomfortable. But when we're in a field where we're working with young children and they're picking up on what we do, they're learning that these conversations are uncomfortable. And so in order to help children, in order to help those who are working with children, I think we have to create these safe spaces where it's okay to talk about trauma in relation to race and equity as well.
Thank you, Misty. And last but not least is Brandy from Pennsylvania.
Good afternoon, everyone. I'm Brandy Fox from Pennsylvania. I work at the Pennsylvania Key. My primary role is the state lead for the Infant Early Childhood Mental Health Consultation Project that serves all 67 counties in Pennsylvania. But my other role also is to bridge the Office of Child Development and Early Learning with our other state departments around infant and early childhood mental health. And as I was listening today and reflecting about the landscape that we're in around social unrest and a global health pandemic, the idea that resonates with me today is how many individuals in our communities are riding this wave of trauma in their own very individual ways. And there's parallel process in this concept in that what we know, what we do, and most importantly, how we are is integral to promoting healing in our communities and through our spheres of influence. And that everyone, no matter what your scope of work is in your community, your state, your region, can support healing in those around you.
Thank you, Brandy. If we could go to the next slide. So we're prepared to have a discussion with you, and I'm going to have them take down the slide deck so you can just see the presenters, and we're going to have a discussion amongst ourselves around key early childhood, early care and education programs, having the effective tools and strategies that they need. What does it mean to sustain trauma-informed practices and then touch on secondary trauma? And then what we really need is trauma-informed systems that are setting up the leadership, the connection between sectors, and the use of policies and practices that support work at every level of the system. But we want to make sure that we're talking about the parts that are most interested to you. So while we're having the conversation, if you would like to use the chat where you would like to see us talk more or you have questions, we will definitely be responsive to you about where you're hoping the conversation will head. So as we enter into that conversation, Brandy, I think you were going to kick us off on this topic about how do we ensure that early care and education programs recognize trauma and have effective tools and strategies. And your state has been having conversations with parents, providers, and directors. And I was wondering if you could kick us off with sharing some of the things that you've been learning.
As my team, and so I have an amazing infant early childhood mental health consultant team of 29, which is really exciting. And we were thinking about, how does our team think about mobilizing and supporting the field in this landscape that we're in, where everyone is kind of pivoting, everyone is having a rupture in their relationships and their routines. And so what can our team do to better meet the needs of the field? My team created this idea of holding spaces. So how do we hold individuals in mind or groups of people in mind during this time? How do we help them reconnect, rebuild relationships, or think about relationships maybe with the children that are coming back into care? So we created holding spaces for parents and providers and directors, where we centered conversations around 4 topics around regulation, around reassurance, relationships, and resilience. These 4 R's that really can frame how we are and what we do in our communities. Because what we know is that if we're dysregulated as adults, we can't regulate a dysregulated child. And so we really brought individuals together. We actually had more than 700 participants across 4 calls in the month of May and June. Where we talked about these topics, but we also used that information to guide some state systems development. Many of the individuals participating were very, very worried and anxious around health and safety topics. Not necessarily the expertise of my team, but we have a team that we're creating. So we use the feedback from the participants to feed our state system and our technical assistance and our coaching system in order to meet the needs of those individuals and create resources. But the key in these holding spaces was the connection between the individuals with role alikes or the same audiences. Parents were telling us that it was really great to be able to be heard and not interrupted. It was really great to know that I'm not the only one feeling this way or struggling with this. And the same with the directors and the teachers, being able to connect them with other people from across the state so that it normalized their feelings, their anxieties, their stress. And they were able to connect with each other and brainstorm about things that would make sense for their program or their families or their children. And the neatest thing one of my consultants said is at the very end of one of the teacher sessions, so they'd had 4 events together, at the very end, they saw every single participant wave at each other and say goodbye and say, I can't wait to connect with you. So they had already formed these natural professional connections that we knew were going to go over time. So that was really powerful.
Thank you, Brandy. Misty, I was wondering what your experiences was like, because you've been rolling out in Ohio a lot of training in response to the pandemic and what has been going on in the state. And I was wondering if you had some similar experiences in interacting with providers who are accessing your training as Brandy did, or if you had something different to share.
Yeah, so I think the biggest surprise has been how incredibly filled the trainings have been since the pandemic started. We are just getting record numbers of people who are looking for assurance and help during really uncertain times. And one of the biggest things that we're seeing our school districts focusing on at this point is that resilience for adults, and recognizing that it's a concept that's nearly impossible to teach to children if we're not practicing self-care, if we're not looking at our own resilience, if we're not fostering that in one another. So I have a lot of people looking for resiliency training for adults and self-care training for adults in partnership with the trauma trainings. And in each trauma training that we offer, you know, we're seeing a lot more people looking for, what is this going to look like long term? We know we've had our children who are in homes for the last 4 or 5 months, maybe not getting their needs met. Parents who are likely not getting their needs met. And again, tying that back to those marginalized communities, they're going to have a completely different experience than some of our other communities are going to have. And how do we support one another? So we've seen an increase in attendance in trainings. We've seen an increase in interest in things like communities of practice, where professionals are getting together and sharing those frustrations. We've seen an increase in school districts asking for opening day resiliency training, opening day trainings about hope, just really anything that we can do to support the people who are on the front line and the administration who's supporting those who are on the front line as we support children and families who are going through the unprecedented challenges that we're facing.
Great, thank you, Misty. Tonia, I was thinking about what you were sharing with me about really thinking about the impact of all of this on marginalized childcare providers, and it kind of resonated with me with the comment made in the chat right now about thinking about equity across our early care and education programs, and that the resources are not the same about what's available to them, about how they think about their ability and what they have access to support both the teachers and providers as well as the children and families. And I was wondering if you had some reflections about either what was shared in the chat or your experience in New York City as you think about what are the trauma-informed strategies that we need to be offering our programs?
Yeah, I mean, I think it's big, right? I think definitely resources are different in different communities. Funding is different. And some, you know, in New York City, you know, they just put out an article in the New York Times that wealthy families in New York City, primarily white families, are putting together pods where they are hiring full-time teachers to work with 2 to 3 children. And and educate them instead of putting them back into public school systems or private school systems even, so that they can stay at home. It takes care of childcare so that if every parent is working, the children are in different homes. So the homes have created a pod. This means that there'll be children who will be way ahead and who will have individualized, basically tutoring by a master's level teacher instead of being in school. And so when PDI did some research in New York to look at teachers, I think they surveyed over 400 or 500 teachers, and what they really saw were teachers really worried about the fact that they will not know how to support and manage the children who come back with mental health needs, who come back anxious and worried, and that we need to put something in place that supports children. We don't actually have an early childhood mental health consultation system across our state. At this moment in New York City, we do have mental health consultants in school programs, and then we have them for young programs. So, but the way they're funded can be slightly different. Who gets them, how many hours? And so it's difficult to think about the fact that if most marginalized communities are going to have higher need, and then they only get 5 hours or 0 hours of mental health consultation and support, it's a problem. So one of the things I've been thinking about, even in my own programs, which are in a not-for-profit, don't always get funded, is how can I leverage my relationships? And so my friends and I, who are all clinicians, are thinking about what can each of us do for each other free. And so one of my friends is a domestic violence expert. And so I'm leveraging her to support a program that I have where there are tons of people in need of understanding how to support domestic violence in their homeless shelter. And it's not fair. It's not what we should be doing. But it's what happens often. I have to think outside the box sometimes about how I use my resources. And so I have to decide that I'm a resource and that I'm gonna leverage what I can do for programs to get sometimes what I need, which is unacceptable in a system that is as large as our country. Yet, those are some of the ways we sometimes have to think about it. It means that equity is not happening though. It definitely means that, because it means that schools that have the ability to fundraise at different levels can have more. And that's unacceptable too. But it is where we are. And so I think what you have to think deeply about is, what are your resources? Who are your resources? And not just think small, like we have to hire someone. Maybe there's someone in your network who might provide something for you at either a discounted rate and or would provide it as a swap. I mean, we get really creative at times. You know, there are times in my program I have the funding to be able to support certain things. So we actually do CPP training and COS and different types of evidence-based practices, which are expensive when you're rolling them out. But thinking about how do you leverage some of the relationships you have at times, because I think it can make a difference.
Yeah, and I mean, what your comments made me think about is the kinds of thinking and ways that you're trying to operate, and what would be more equitable and where's the need the greatest is actually the question that we're asking everyone at every level of the system to reflect on. And so there is work with state leaders to think about changes that they've made to try to shift resources to marginalized community where the need is highest, or what is their response going to be, or how are they using their CARES dollar, so then when people like you are receiving resources, that could arm you better. But I think we agree that at the moment, that kind of equity lens of how do we figure out where the need is the highest and what needs to go there is sometimes not always the frame. Nikki, you've been doing a lot of thinking about the deluge of information to providers, and that a lot of the work that people have been focusing on around trauma-informed is around the awareness and knowledge part of the strategy. And I'm wondering what has come clear to you in this work recently about what is the information that's coming at providers from what kinds of sources, and then how to think about what's the range of strategies that need to be considered.
Yeah, it has been, I think, sort of overwhelming. We're all inundated in our email with tips for, coping with what if this happens, or what if we close, or what if we open, or the ever kind of changing set of circumstances and the unknowns. And so what I think has really been helpful to our team here in Arkansas is to sort of step away from the deluge a little bit and remind ourselves that we were out there doing trauma-informed care work with schools before COVID, because trauma was widespread before COVID. And we know some things. We have those core principles from SAMHSA. We have really trusted implementation frameworks from NCTSN, some of those things that are in the resources section. And if we can just dive back into some of those to organize our thinking at a time when it's been hard to be organized, it's been hard to, congeal around a plan. But going back to what we know so that we can then apply it flexibly, regardless of what circumstances get put in front of us. So if we're working with the school and we really help them understand the core principle of safety, one of SAMHSA's 6 principles, what makes kids feel psychologically safe? What would make a teacher feel psychologically safe? Then I could think about what that means for if they're in my classroom or if I just have to zoom into their home. How do I create predictability? How do I create routine? How do I apply those principles regardless of the circumstances? So for us, it's been, okay, take the deluge, but plug it back into the frameworks that we have, the frameworks that we know. And so that's kind of been helpful to us. And then one thing I've been really reminded of, and I think there was a comment in the chat box that brought this to the front of my mind, is that all of our implementation frameworks for trauma-informed care in schools or any organization emphasize the importance of organizational wellness strategies, emphasize the importance of supports for staff self-care, guarding against secondary traumatization as an important piece. But in my experience, that is a piece we gloss right over oftentimes. We're going to get to the part about helping the clients and the kids and the families that we love. And we're not going to sustain through a time like this if we keep glossing straight over that. And so that piece of those frameworks we have to hang on to tighter now more than ever, in my mind.
Yeah, one of the things that we were talking about as we prepared for this webinar was about how do we weave in this idea of secondary trauma for our staff and the technical assistance supports that are going into programs, because that's where the sustainability for trauma-informed practices will really come from, is undergirding or supporting the staff who are trying to implement them. And Brandy, I was wondering, you were trying to think about, I think with us, about the parallel process that you've been experiencing in Pennsylvania and thinking about the self-care that's needed. And I wondered if you had a few reflections for us.
Sure. Just to kind of echo, what Nikki was saying about, how do organizations or systems care for and hold in mind their workforce so that the workforce can care for and hold in mind, the patrons or the consumers of our services. And, and I think that, this pandemic has really forced organizations to think about how do we support our workforce. Our organizations at the Pennsylvania Key really put workforce health, wellness, and stress reduction at the forefront, knowing that if we didn't care for those that are doing the work new, because we're pivoting and we're doing it from home and we're worried about our kids who are schooling right next to us at the dining room table, and worried about the people that we typically support face-to-face in our communities, if we don't take care of them as an organization, how are they able to do their work effectively, in support of their communities? So we did a lot of thinking about parallel process, about supporting the needs of our workforce, about being very creative and innovative about ways that they can continue to do their work via a distance and continue to support those relationships. But we also thought very intentionally about how are the different systems. So I sit at a state level. So how are the different systems working together around this issue, around supporting the workforce, supporting families and young children. And so we did a lot of reflecting on, you know, what's available in our professional development system. How do we build the capacity of our coaches and our technical assistance staff in their coach approach, in their use of reflective practice? How do we help them engage, you know, in discussions with others from different systems like mental health, like child welfare, like primary school and health, on what do we have the same around trauma-informed care and equity? What are we all doing separately, right? And how might we use this process to work better together to identify that mutual foci, and leverage efforts, whether that's funding, whether that's just human capital, whether that's our stakeholder groups or our advisories, and create a shared common language across our systems so that we have better alignment and better collective impact.
As you kind of think about that alignment and impact, where would you say you're in that process? And are providers being able to experience that? You know, I think some people kind of worry in the, you know, I was just thinking about in the state of urgency or emergency, it sound like we usually don't have good space and time for the kind of the cross-sector work you're talking about between early care and ed and child welfare. And then in a state of urgency, sometimes the work gets even more siloed. So is there a hint of a benefit or what everyone's getting out of the process while you're trying to figure out the power of coming together and having the same focus?
You know, I just kind of go back to, and you know, in infant mental health, we talk a lot about the relationship being the intervention.
Yeah.
So engaging individuals from a community or from a program just to connect and talk and find out what they have in common and normalize the, you know, the issues they're having and be creative in the ways that they can do things in a program, in a county, as a regional collaborative, so that we all have the ability to do this and connect with others, and we can take those small steps toward collective impact while some of those bigger systems are trying to scaffold, how do you do this big change?
Right. Right. Tonia, I was wondering what your reflections were on Brandy's comments, and you're sharing with us about, you've been thinking a lot about the self-care techniques that your staff need who are working with providers and families directly, of not always knowing how to respond in the moment, and then they carry the family stories with them from across their day as they interact with other children and families. And I was thinking about the comment in the chat about compassion fatigue and the impact of secondary trauma. So I didn't know if you had some kind of additional reflections or response to some of the things that have been put in the chat.
So I love the ideas, Brandy, of really thinking about how the larger systems can sort of support what needs to happen in the programs and on the level that, you know, my programs exist. I think what happens sometimes is that doesn't always trickle down in my programs, you know, right? Like that change is happening. And so one of the things we've talked a lot about is, right, really thinking with staff about, do you really need an entire hour meeting? And I think that's something that people don't often hold in mind, that, right, yes, we always did our supervisions. Yes, we always met an hour. Yes, we always did those things. And sometimes we're shooting the breeze, laughing, or doing something. There are moments where giving people back a few minutes can make such a big difference. And so really thinking, we've really looked at and thought about, as we've moved forward, how many meetings do people really need to be a part of? And as our schools go back, the question is going to, you know, everybody's trying to decide if we're doing a hybrid model, if we're doing this. My question is, what are we doing to support the teachers? And that was a question also in this comment, in this chat. Like, what can we be doing to support our teachers who are going in and experiencing the highest level of stress they've ever experienced? Something about being in someone's home and going from home to home, depending on how you're teaching, is very different for teachers. They've never had to think about that before. People came to them. And so we've put teachers in this new situation and didn't really think about how we would support the emotional challenges of going from one home to the next and what comes up during those different visits and what comes up for them if the parents aren't dressed in certain ways, if the house looks a certain way. And depending on where you are, this is where, right, race, class, privilege, equity, all these things play out. Depending on where you're from and what you think a house is supposed to look like, you may get anxious, may feel overwhelmed. And so I think we have to be thinking a lot about how we're going to support teachers and staff as they go back. And so one of the things we've been thinking about is how to create small groups to give them opportunities to talk with someone, and creating those groups where it's not actually a supervisor in them. And so we've been thinking a lot about how to use some of our consultants for that in different ways, and being more strategic about time limits on some of that. And then also we've been talking a lot with supervisors around how to think about when someone may need an EAP or may need some time, a day off here, a day off there. We've never really been very specific about taking a mental health day. We've said it, but we're much more strategic as we're supervising and thinking about this, because people don't feel like they can take a day off either. I don't know how other states went, but in New York, when we went into the pandemic, our mayor and our governor decided you can't get your break. And so a whole week where teachers were supposed to get a break, they didn't. Why, I don't know, because they're working quite hard in the system right now.
Mm-hmm. Mm-hmm. And it's interesting to think about, someone shared in the chat to think about, again, the equity issues, right? That as schools, a lot of schools across the country that have increasing rates are definitely choosing distance learning, but then that actually means people are turning to childcare to say, can you provide a safe place for children, for families that don't have a choice and have to go back to work? And so still some form of education and care is being asked to be delivered in person, even if it's not the literal school building. Misty, you kind of talked about similar issues that you were experiencing in your trainers a lot around the kind of fear of the unknown, and how that might kind of interact with this and how we support those who are working with children and families. So I didn't know if you had any reflections to add on to Brandy and Tonia's comments.
So one of the things that I saw in the chat box was somebody talking about common language in response to Brandy's conversation. And I think that parallel process, has to be looked at every level. We tend to look at it in pieces, but the parallel process is top down, right? So looking at who's supporting administration while they're making these incredibly difficult decisions, who's supporting school board members, who's supporting people who are having to make these really tough choices, and then tell the teachers to go back into the schools. And so I think that one of the things we've done that has been effective is we have partnered with agencies all over the state. Department of Mental Health and Addiction Services supports work in early childhood education, and that funds the training that I do. And I started off training early childhood educators, and then it became administrators, and then it became policymakers, and then it became doctors and nurses and DGFS employees. And I think having everyone, as much as we can, and I know it's a dream world, but the common goal is to do what's right for children, to do what's right for families. And so when we can get people coming in and we can stop siloing, and we can put the welcome mat out and say, come on in, because we have a common goal where there has to be common language and there has to be common training, right? I have to create a trauma-informed atmosphere that includes those SAMHSA principles that Nikki was talking about. But if I'm doing it differently than the next agency is doing it, then where is that cohesiveness? And I think that cohesiveness is what we have to move forward to now. There is no time to say you can't come to the table. The welcome mat has to be there for every agency that's working through this crisis together.
Nikki, you were sharing with us while we were preparing about thinking about the longer term system change. And I feel like a lot of the comments that have been made are kind of implying that about what we need. And what's the long-term change around that we have to really move beyond knowledge and awareness. So I didn't know if you had some additional reflections to share with us.
Yeah, I think just, briefly, I I think that this time has brought attention to this issue and maybe widened our understanding of the need to have organizations at every level that are equipped to support those going through trauma. And we'll still need that when COVID is done. Like, trauma doesn't go away, right? It was here before, it will be here after. And having patience for a process that is a longer journey, and that having our systems that fund professional development, for example, let us move off of quick trauma awareness workshops and into, as I'm happy to say Arkansas has done, longer term, more intensive partnerships with programs who say they're ready to move, ready to change. And so diving into those implementation frameworks and saying, okay, it's gonna take time, but we're gonna look at our policies and our practices and our staff training and our physical environment, and we're gonna do a little bit piece by piece, and it's gonna be a journey and it's gonna take time, but it's a worthy investment. And so I hope that we'll start to see at every level folks with the idea that this is a worthy long-term investment and that we're going to resource it kind of accordingly. And I hope too that that the bigness of it doesn't daunt us, but that the fact that trauma-informed care is so big encourages us to say that, like, there's lots I can't control, but this is in my sphere of influence, so I'll start there, you know, and that there is a starting point. And anywhere you start is better than not starting. So I hope that this just encourages us to find some steps to take toward kind of a longer term investment in a journey.
Tonia, do you want to share a little bit about, you said that the city was doing data analysis and hearing from the teachers, and that you were really hoping that that laid the groundwork for a comprehensive response from public agencies and policymakers. So I didn't know if you had any kind of final reflections for us as well.
Yeah, I think when I read through the study that they've done, it really says, help us. Like, help us think about how to hold and support children. And you are correct, Nikki, there's been trauma for years. And there was a systematic approach occurring around Trauma Smart. But I think it didn't get to everyone yet. And so there are some schools who have the language and then schools who don't. And so teachers were saying they're anxious. They're anxious about helping and supporting families, but they're also anxious about their own families. And so I think we have to hear that when we're doing this work today, we have to do the trauma work on multiple levels and have to hold that there will be the trauma that our children experiences, the trauma that the system has experienced, and the trauma that our educators, administrators, and others have experienced, and how we're going to hold these varying pieces and make space for the work. I would really think is the goal for all of us in every state. How do we make enough space for it, especially the larger the system, right? New York is pretty big. So the larger the system, how do you make space? And then the other systems, how do you continue to grow the knowledge that exists in the communities? Because it's there. Nikki is absolutely right. We've been doing the work. It's now time to really think about how we roll it out and keep it at a level that helps and supports teachers and families and the community.
That's right. Thank you, Tonia. Jonathan, if you could bring back the PowerPoint back up. In our last few minutes, I just wanted to see, Brandy or Nikki or Misty, do you have any other final conversations? I'm going to have the poll be posted. So what we want to know from all of you is, would you be interested in a webinar series or a community practice where we could dive deeper into this subject? And you'll scroll down and there's a second question about, if yes, what would you like the focus to be on? And you can check all that apply to you. So we could go deeper in the science. We could do role-like discussions. So if some of you are from certain parts of the sector and you want to get together with other providers or other QRIS TA providers or that kind of thing, we could do role-like. We could actually dive into specific trauma-informed tools and strategies beyond the knowledge and kind of awareness tools that are happening a lot in states. So see what options there speak to you, and we're happy to hear from you. But any other final comments, Brandy?
I think, my final comment, and I'm always, worried about, will someone participate in a webinar and hear us talk and be able to walk away with something that resonated with them, with the next step that they have. And I think I would just, summarize that, every interaction we have is an opportunity for healing. And so for all of you that are in the field that might be supporting children and families, remember, serve, and return. Remember the power of family engagement and relationships and making eye contact and just being with and holding space for individuals. And that's parallel process. Relationships are at every part of our community, and a drop in the bucket creates those ripples that can be healing moments.
Thank you. Any other comments, Nikki or Misty?
And I would just say, remember that responses are as different as experiences, right? The way that I respond to something may be very, very different based on the experience that I have. And sometimes it just takes a little more time to understand that perspective, to understand that ride has been a little bit different. And so I think spending some time understanding that, looking at our marginalized communities, looking at race and equity, and putting that as part of our trauma-informed lens every time is important to remember in light of not only COVID, but some of the other challenges that are facing our nation right now. So things to keep in mind moving forward.
Great, thank you. If we could move to the next slide. What I wanted to let you know is that what's being posted on the website is some of the materials that the panelists pulled together for you of what's really informing their thinking, as well as some material from each of the states. So what you have be able to link to, and all of these are hyperlinked for you, is the CDC SAMHSA materials that were referenced. The National Child Traumatic Stress Network has frameworks where they really delineate the 9 or 10 strategies that you can be doing, and only one of them is about knowledge and awareness. And they've recently come out with a publication about their framework during COVID. So there's several pieces there that if it's helpful for you to think about the kinds of things Nikki was saying about how do I organize this deluge and what's my framework that I want to use. There's some frameworks there that might give you the categories, and then you can realize where you've been supporting programs and families, and where are some places that you might want to build out. And then on the next slide, I just wanted to share, and then we have, I found when we were doing some research that, this has been a longstanding issue about how do we support families and children and staff who've experienced trauma. So there were ongoing materials from DHHS and Georgetown and West Ed. So depending on what resonates with you and where you are on your journey of implementing trauma-informed strategies, these might be helpful. And then the last slide from us is Arkansas, Ohio, and Pennsylvania all have developed materials and shared their framework and their way of thinking. And Ohio shared the top 10 tips that they're sharing with parents and caregivers. So I hope that these are helpful to you to see how materials are being pulled together that might support your work, as well as some specific state examples of what has been developed. And we thank you for spending your time with us. And I'm going to turn this back over to Debbie, who will talk to you about next steps, and that we hope you'll provide some evaluation of this session.
We just wanted to say before you sign off, we encourage you to give us some feedback on today's webinar. Some poll questions are popping up on your screen, and let us know in the chat box what was useful, significant, or new, and how we can improve the webinar and sessions for you. I'd really like to sincerely thank our session leaders today for this interesting, compelling, and informative and timely topic and opportunity. We appreciated the contributions from the participants in the chat box and hope to see everyone again soon. Thank you.